I hope we have enough memory on here.
Yeah.
Welcome to the Face Duo. We're going to talk about a hot topic today. This hot topic is buccal fat. We're going to answer, what is buccal fat? Can taking out buccal fat make you look older? Why are all the celebrities potentially doing it? We actually disagree, I think, on this one a little bit. So let's get into it. Dr. Dunn, what is buccal fat? Where is it? Why do we have it? What is it doing?
The embryologic
origin. What is buccal fat?
Okay, so buccal fat is one of the deep fats of the face. It's located in the cheek as well as in the temple. It's a bilobular piece of fat, and we'll have a picture over here. So what it is it provides fullness in the area between the cheeks and the jawline. And so individuals that have fullness or heaviness in this area can have buccal fat removed to help soften this transition or even sculpt that transition a little bit further.
Yes. And the thing to remember is buccal fat is not here. So if you have a little bit of fullness here, that's not buccal fat.
That's the jowl.
Yeah. So can buccal fat removal make you look older? This is probably a huge question that people are asking, because there are some celebrities that look like they've had buccal fat removed and they're looking older. So personally, I don't think that if you take small amounts of buccal fat and you are doing it in a conservative fashion in the right patient, it will make you look older. Because very frequently when we're doing facelifts, we see what we call ptotic buccal fat that has descended with age, and that descent makes you look actually older or more jowly, just more full in the lower part of your face. So taking the excess buccal fat, the small amount that is there in addition to what would look sort of quote normal, can't really make you look older. It's when you sculpt lots of buccal fat, take a lot, then you can start to maybe look a little bit older. But buccal fat is a deep fat pad. These superficial fat pads of the face are really what make us look more youthful. These are the fat pads that shrink with age, that change position with age, much more than that deep buccal fat pad. So that's my opinion based on what I understand about anatomy and my surgical results. What do you think?
Yeah, I think that it can if you select the wrong patient.
Yes,
and so,
sure.
Which I guess we would agree on that. The typical question that I ask my patients is, what do your parents look like? Do they have really sculpted, gaunt faces as they've gotten older, or do they continue to have fuller faces as they've gotten older? And so if you have, because there is somewhat of a genetic component to the overall facial structure of your face and the fullness of your face. And so if you have parents that do look much slimmer, they looked a little bit heavier when their face looked a little bit heavier when they were younger, and it looks much slimmer as they've gotten older, then you may not be the best candidate, and it may make you look older. If you have parents that continue to have fuller, rounder faces as they've gotten older, then I would feel much more comfortable removing buccal fat for them.
Okay. What are some complications of buccal fat removal? I'll go over one.
Okay.
Can I go over one?
Just one?
Yeah. So one complication that I have
Cherry
not seen.
picking.
You can do the other ones. You can do another one.
Okay, fine.
Do you want me to do one?
No, yeah, go.
You have two salivary glands that are in your face. They're called your parotid glands, and they secrete saliva into your mouth. The buccal fat pad is in relatively close proximity to the duct that drains saliva into your mouth. So if the surgeon gets into that duct, which is something I talk to patients about, you can have problems with that salivary gland. You can have backup of saliva into the gland. It can be painful. It's a rare complication, but because of the proximity to the fat pad, I still talk to my patients about this potential risk.
Yeah, and I'd say one of the other risks that are very uncommon but can happen is if you're too aggressive with buccal fat on the outside of the fascia, or the attachment of the buccal fat runs one of the nerves that helps to control your smile. And so if you really are aggressive and you're pulling really, really hard on this, you can actually injure or weaken the nerve that controls those muscles. And so it can distort your smile. And so it's very, very uncommon. And that's why I think it's important as a surgeon to kind of listen to what the body is giving you and not overdo it, so it minimizes risks.
Okay, so we've taken the buccal fat out, and patients will ask, what do you do with the fat? Do you throw it away? Can you do something with it? So what are your thoughts?
I think this is extremely rich fat that is an optimal use for other areas of the face. And so you can process it in a way that you can actually inject it when it's cleaned in the under eye or in the chin. I had really nice results with buccal fat basically being repurposed for other areas.
Absolutely, yes. You can morselize it, you could put it in other areas, but it definitely can be reused. So we basically are taking fat where it shouldn't be and putting it where it needs to be.
Right.
So if you are interested in buccal fat removal or anything facial aesthetics, whether it's surgical or non-surgical, our consultation and information is in the notes. Like, subscribe, and follow for more, and we'll see you next time.